Welcome. I will be presenting today data generated in a collaboration between investigators in Turkey, specifically in Ankara and Izmir, and my own group in Mainz in Germany. These are our disclosures. The underlying studies were funded by grants from the Turkish and German Research Council. As you probably are aware, bladder dysfunction is frequent in diabetes. Streptozotocin destroys pancreatic beta cells and thereby can induce diabetes experimentally. This is considered a model of type 1 diabetes. Many studies have shown that this is associated with a doubling in bladder size. Several studies have shown that this increased bladder size can be prevented or reversed by treatment with insulin. However, little is known on the effects of oral anti-diabetic drugs on bladder size and function. Therefore, it has been our research question to explore the effects of the SGLT2 inhibitor empagliflozin on bladder weight in rat STZ model. Of note, empagliflozin is primarily indicated for the treatment of type 2 diabetes, but initial studies demonstrate that it also has some value in the treatment of type 1 diabetes. Secondary outcome parameters of our study were bladder contraction and relaxation. These are our methods. We used female Sprague Dawley rats allocated to 3 groups. These were control, STZ, and STZ plus empagliflozin. We used 20 animals per group. The treatment with empagliflozin or its vehicle started on the first day after glucose had exceeded 300 milligrams per deciliter and then lasted for 9 to 10 weeks. Based on this early start of the treatment, our study can be seen more as a prevention than as a treatment design. At the end of the study, we performed concentration response curves for isolated bladder contraction by carbachol and relaxation by isoprenolone as a mixed beta agonist, for phentoterol as a beta-2 agonist, and for Cl316-243 as a beta-3 agonist. These organ bath experiments were planned to be done on 8 animals, but due to loss of some animals were restricted to 6 or 7 per group. Data are shown as means plus minus standard deviation. No hypothesis testing statistical analysis was performed due to the exploratory nature of the study. Let me first show the parameters we assessed as model validation. In general, STZ produced the expected effects. That is, a major increase in blood glucose, a reduction in bladder weight is also seen in type 1 diabetic patients, and due to diabetic polyuria, an increase in urine output. Empagliflozin attenuated the increase in blood glucose, and despite being a diuretic or a mild diuretic itself, the increase in urine output. However, it did not attenuate the reduction in body weight. Bladder weight was the primary outcome parameter of our study. Again, STZ produced the expected change in bladder size, in this case about a tripling of bladder size. This was attenuated by empagliflozin, but not eliminated. Similar data were obtained when we used the bladder to body weight ratio. Our first secondary outcome parameter was contraction of isolated bladder strips. In these experiments, minor, if any, changes in the potency or efficacy of the muscarinic agonist carbachol were observed. The potency of carbachol was about 1 micromolar in all groups. The maximum contraction increased somewhat, but notice the large variability between animals. Similarly, receptor-independent contraction by potassium chloride increased somewhat in the STZ but not in the EMPA group. The other secondary outcome parameter was relaxation. Again, minor, if any, changes in the potency or efficacy for the beta receptor agonists were observed. The potency was similar in all groups, that's about 100 nanomolar for isoprenolone, 800 nanomolar for phenotyrol, and 40 nanomolar for CO316-243. If we look at the maximum responses, again, large variability between animals. There may have been a minor increase in the STZ, which clearly wasn't attenuated by empagliflozin. If we look for relaxation by the receptor-independent stimulus of forskolin, we didn't see clearly any increase, if anything, a slight decrease. To summarize these data, STZ injection caused the expected changes in blood glucose, body weight, urine output, and bladder weight. Early intervention with empagliflozin attenuated, but did not eliminate, glucose elevation and bladder weight increase. However, this was accompanied by only minor, if any, changes of contraction and relaxation, either to muscarinic agonist or beta receptor agonist. Empagliflozin attenuated changes despite its diuretic effect.